Excellent. Thank you. Thank you, Cheryl. Good morning, everyone. Welcome to today's public session of the Oversight and Engagement Board for January the 7th. And it is just gone. It's just 10 minutes, 6 minutes past 10. Welcome to everyone. Can I say Happy New Year to all those that are watching us live and all of those people who are here on the call today. Thank you very much for attending. We'll go straight to the next item, which is the minutes from the previous meeting held on the 10th of December 2020, which seems like an awful long time ago, and an awful lot has happened since then. I'm looking around the room. If everyone's happy with those minutes, we will sign them off. Thank you very much. And then that comes straight to the COVID-19 summary data, and I'll hand over to our Director of Public Health, Lucy Whiteman, to run us through that. Thank you, Lucy.
Thank you, Councillor Morris, and Happy New Year to everybody. It's good to see everybody again. So what we've done, because we haven't produced the surveillance reports over Christmas, just really to allow people to obviously regroup and recharge, having had such a busy year last year, we've pulled together a bit of a summary of the data that will be going into the report tomorrow. So this is a slightly early sort of sneak preview of the surveillance report for tomorrow. So this report just contains data up to the 1st of January 2021. So if we go down to the first key graph. So here, obviously, you can see that we've had a significant step change in our cases, and I'm sure people are aware nationally that there's a very similar narrative. So in the week up to the 1st of January, there were 3,814 cases in Northamptonshire, which is a statistically significantly large increase compared to previous week. The 7-day peak has obviously reached a new high. As people can see, it is markedly higher than any other case rate that we've ever had previously, and very much indicative of the fact that the new mutant strain is in Northamptonshire. So just to be clear, we haven't had specific typing done locally. There is a very limited availability with regards to typing, but genome sequencing does suggest that the virus is prevalent across all parts of the country, but this steep and very rapid increase in cases is very in keeping with those areas that have had the typing, and therefore very much we are operating on the assumption that the virulent strain is here in Northamptonshire. If we go down to the next slide. So obviously a sea of red increasing arrows. So this is the crude number of cases per borough and district over the 7 days up to the 1st of January. So we can see, what is a huge number in Northampton, obviously because of the size of the population, but 1,482 in Northampton alone in that week. Now that's the kind of number that we would have expected to have been seeing at our worst period for the whole county only a number of 3 or 4 weeks ago. So, it really does give people an idea of the step change in the infectivity of this new strain. Obviously, we're now dealing with 2 strains, and this now, as people can see from the narrative, means that our total number of cases in that last week is 6 times higher than the weekly total seen mid-September. So, a significantly deteriorating position locally with regard to infection rates. If we look at the rates per borough and district on the next slide, that allows us to compare area by area. So again, you can still see that we've got an increasing picture across the piece. All of our boroughs and districts have seen a large step change and increase in the case rates pre-Christmas to this week up to the 1st of January. The Northamptonshire rate is now 406. That is higher than the East Midlands rate, but slightly lower than the England average. From a point of view of the boroughs and districts, you can obviously see we've got a big range of different rates here. Northampton at 531.1 cases per 100,000 as a rolling 7-day average, all the way down to Kettering, which at the moment sits at the lower end at 292 cases per 100,000 population as a 7-day average. So, that again is still an alarming rate. It is much, much higher than we had previously seen, and obviously much higher than the government had anticipated when they designed the new 3-tier system. Hence the changes just immediately prior to and during the Christmas period with the introduction of a tier 4 and then obviously a move to a national lockdown. As I said, Northamptonshire overall has a higher rate than the East Midlands average, and our boroughs and districts currently are the sort of top 1 and 2 boroughs and districts in the whole of the East Midlands with regards to case rates and infectivity. So that's South Northamptonshire and Northampton at this point in time. So really alarming position, very likely to have been influenced by our geography. We have been obviously neighboured by areas that have been tier 3 and then tier 4 in recent weeks, and sadly, you know, that will have had an effect where people have commuted for work, where they have mixed over Christmas and New Year, and therefore obviously we've just seen this significant spike in our numbers. If we have a look at the next slide. So again, this is just reflecting that obviously steady increase over quite some period of time now, but there's obviously clearly fluctuation, a reduction with the small lockdown that we experienced in November, but then a significant and very rapid increase. So a very much more acute angle of increase for all of our boroughs and districts in the most recent weeks. Again, you know, none of the areas have been immune to this, and none of our age groups are immune to this either. So if we move on to the next slide. So this is the case rate in the over 60s. Again, we know that this is highly correlated with the number of admissions and sadly deaths that we see in our county. So again, very significant and stark increases and upticks in that sort of last week or two in the graph shown. This is not because the strain that's been identified obviously makes people any more seriously ill, or in fact is not at this point in time known to increase the overall mortality rate, but the sheer number of people that are now infected is clearly increasing the number of over 60s that are now infected, and in turn that is increasing the number of people who are being admitted to our hospitals. We've now got around 30% of our bed base occupied by COVID positive patients. That means that obviously there are pressures on staff because they're also affected by the infection rates and by the need for isolation if they're identified as a contact. We've got staff impacts from a point of view of obviously school closures as well. So with a significant proportion of our bed base occupied by COVID positive patients, the need to space out those COVID positive patients for infection prevention and control reasons, coupled with staffing challenges, etc., our NHS system, wider NHS system into our primary care colleagues and community care colleagues as well, are extraordinarily stretched. Now, we know we do recognise that many people are asymptomatic carriers and may not be concerned about the fact that if they catch COVID that they'll become particularly ill. The challenge here though is that we've had to step down all but our urgent care and all but our cancer care. So if people were in need of an urgent operation, for example, they would still be able to get it at this point in time. If our case rates continue to increase, that availability of additional bed space to deal with the business as usual urgent cases will become more and more stretched. So, you know, it's really a message out there to people who think that COVID is not particularly an issue, and it may well not be if they catch it, but the pressure on the system now is getting to a point where we won't be able to provide them with urgent and emergency care for other reasons, should they become ill and need that support. So it is, a really stark message, both from a point of view of COVID cases, but also our ability to respond to other types of medical emergencies. If we move down. So you can see that we're still very much being affected in the larger working age population. So the broad number of cases are in that younger age group. We've got a big increase across the country, in fact, in the 17 to 21-year-olds. In these 10-year age bands, you can see that in one gender, so we've got, I think it's men aged 20 to 29 are the most affected, or we've had the most number of cases, sorry, it's women aged 20 to 29, we've seen the most number of cases, and in males 30 to 39. So very much working age adults. But the transmissibility, the high infectivity rate of this new virus means that it is obviously quite quickly spreading through the wider community, through families, and this obviously is the beginning of the effect of mixing over Christmas, and we certainly haven't seen the peak of it yet. At the moment, the estimates are that for every one person infected, because the R rate is above 1, around 1.3, that person is infecting more than one other person. So we're still very much in a growth phase of this new virus. And therefore, obviously, we are not past the worst peak of either cases, but also demand on our NHS services. So a very stark reminder that the reason we've had this lockdown is to try and curb that onward transmission, and people really, really need to comply. We go on to the next slide. At the moment, the lockdown and the Christmas period has given us a slightly welcome relief from the number of outbreaks, but in this last week, again, if people have returned to work, we have seen the number of particularly workplace outbreaks increase. The interesting thing about the workplace outbreaks, and indeed more generally outbreaks, is that although we've had a smaller number of outbreaks in general, they have included, when they do happen, many, many more cases, and they are much more complex from a point of view of contact tracing, understanding the vectors. A lot of the communication and transmission is still happening outside of these settings, but obviously because we're doing routine testing, and there's much greater surveillance of these high-risk settings, that's how we're picking up the outbreaks. So please, people need to be very, very vigilant. If they are having to car share to get to and from work, to do so wearing face masks, always washing their hands afterwards, keeping the car well ventilated. Similar on buses, if you're having to catch a bus, to be wearing your mask over your nose and your mouth throughout your journey, and then obviously be washing your hands as soon as you're able to at the other end. Hands, face, space are still some of the 3 most effective measures against transmission, even with the new virus. If you cannot get close enough for somebody for the virus to transmit, if you keep your hands clean, and obviously if you wear protective face coverings, you are highly, highly likely to be able to avoid onward transmission. So please, 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 despite good news about the virus and the vaccine being rolled out, please do be aware that this is a very virulent strain and people need to be adhering to those rules.
Thank you very much, Lucy. Some sobering stats in there, but as always, very well presented. Thank you very much. I'm looking around the room for some questions. We're going to come on to a testing update. I wondered whether at this point we could bring in Toby Sanders to just give us a very, very broad brush vaccination update, if he's happy to do that, and then come on to you on the testing update, if that's okay. Toby, hi.
Hi, Chair. Yeah, absolutely happy to do so. And just perhaps before stepping into the vaccination piece, which obviously is a very positive kind of light and the way through all of this, just to absolutely emphasise Lucy's key messages there from sort of health and care perspective in terms of pressures across the system. Everything that we're looking at and modelling at the moment from an NHS and from a social care perspective anticipates that pressure is going to continue to build over the next couple of weeks. So we're in a very, very different place, the most pressured place operationally at any point in the last 10 months of this pandemic locally. This is not just an issue in London and the South East. This is absolutely a Northamptonshire position at the moment. It is the reality, and it's a reality we're expecting to get tougher. So please to continue to listen to the messaging there and the important kind of guidance that Lucy continues to remind us of. But to things slightly more kind of positive, Chair, in terms of the way through this, because you're right, we all know nationally and locally that the way out of this and through this is going to be the speed at which we can roll out the vaccination programme. I'm delighted to be able to share today that we're making really good progress on this at the moment across Northamptonshire. And that's testament to the enormous amount of work across a whole range of particularly health and local government partners, in particular our acute hospitals, NHFT, our community mental health provider, and absolutely our general practice teams who have been working absolutely night and day to make sure that we can roll this out as rapidly as we can. So in terms of a quick summary of where we are today and this week, we currently have COVID vaccine being delivered through 3 routes at the moment, and with a 4th anticipated to come on stream over the next couple of weeks. Those routes, firstly through our hospital hubs. You'll recall that before Christmas on the 9th of December, we went live with the first of those hospital hubs at Northampton General. We now have a second site that's operational at Kettering General Hospital as well. So we have 2 of our hospital hubs up and running. They've been delivering the Pfizer vaccine from the outset of that rollout, both to over 80s in the first sort of cohort priority, but also to healthcare workers, not just NHS, but care home staff and workers as well. In addition to that, we now have primary care network delivered services that are running through GP practices. So this is groups and clusters of our practices coming together in groups of 3, 4, 5 practices, working as a team, making sure that they can roll out the vaccine to patients registered with their practices. I'm delighted to be able to say that by the end of this week, we will have all 16 of those primary care network sites up and running and operational across the county. That is a tremendous achievement to have reached that pace so rapidly. It was only back on the 15th of December that the first of those sites went live. So by the end of this week, we'll have all 16 of those sites up and running, and they will be providing vaccination services to patients registered with all of the practices across Northamptonshire. So we get that complete coverage by the end of the week. And again, just to emphasise my thanks to those primary care teams who are doing that alongside trying to keep everything else running we can within primary care. The third route, Chair, which is up and running at the moment as well and being rolled out further this week, is the provision of mobile support into particularly care homes for residents of care homes, as we know within that priority 1 cohort group. We've already started to do that through a number of our larger homes, and there's further rollout of that, particularly as we start this week and have started to receive the Oxford AstraZeneca vaccine into the county as well, which for all sorts of logistical reasons that we're familiar with from national reporting in terms of refrigeration and transport, the Oxford AstraZeneca vaccine is much more mobile and therefore lends itself to that mobile service that can reach out into our care homes. I mentioned at the start, Chair, there was a fourth kind of route that we're expecting to bring on stream over the next couple of weeks, currently expected to be towards the back end of January. And that'll see a larger vaccination centre running within Northamptonshire that's able to provide significant additional capacity in terms of further vaccinations, both for staff and potentially in the longer run as well for the public as well. So all of that put together means that at the end of the day yesterday, we'd already managed to deliver over 20,000 vaccines to our staff and to our priority cohort population, the over 80s and care home residents during the last number of weeks. And if you put that into context, we'll all be familiar with the national ambition to be able to vaccinate all of the first 4 priority cohorts by the middle of February. For Northamptonshire, that would be about 135,000 people being vaccinated by the middle of February. And so you can see we've already made a really good step towards that. And the pace of that is going to step up over the coming weeks. So huge thanks from me to the enormous team that have been putting their effort into all of this. We really are in that kind of race of time here of being able to deliver this as rapidly as we can, whilst still continuing to stick to all of the guidance that is so important to buy us as much time to be able to get through this in good shape for everybody. Thank you, Chair.
Thank you very much, Toby, and thank you for the amazing work that's going on in the county. I really do think that we have pulled together extremely well on this crisis and continue to work very well together to help deliver what is very important. But of course, and there is light at the end of the tunnel, as you say, with the vaccination, but now's not the time to take our foot off the brake, to stop following the guidance or any of that, because wouldn't it be a shame if somebody became ill now and possibly died of COVID as a result of breaching the rules when we've got the vaccination within reach? It would be a crying shame. And also the hospitals being overwhelmed would also lead to lots of other problems. So we must all keep following the rules and obeying the guidance as much as we can, or completely, and wait for this vaccination to all come online. So thank you very much for that, Toby. Lucy, I'll come back to you now for a testing update, which I think is crucial as well as one of our weapons in the arsenal against this disease. Lucy.
Thank you, Councillor Morris. So with regards to symptomatic testing, so this is the PCR testing that's done through our mobile testing units, our local testing sites and our regional testing service. Demand peaked in the days before Christmas and has been reducing slightly since. I think a lot of people went and got tested really before they were mixing over Christmas. We are obviously encouraging people to continue to get tested if they have any concerns, if they are developing any symptoms. They must go online and book their test, and they can either do that at one of those local sites or do it with a home testing kit. But they must be isolating if they have symptoms until they get that test result. But given the high rates that we're obviously experiencing in the county, we've actually been given a third mobile testing unit again, and it had dropped back down to 2 just before Christmas. And the 3 mobile testing units are currently posted in Northampton, South Northamptonshire and Daventry, because those are obviously the areas that are most greatly affected at the moment by those high rates. From a point of view of asymptomatic testing, so this is the lateral flow devices that give you a quick result, but are less sensitive and specific, so it's slightly less accurate than the PCR tests. We've had our first delivery of those tests locally, which is very exciting, and we're rolling those out with fire and police. So they've started their training this week, and that should go live for testing from the 18th of January. And then children's social workers and adult social workers are then being identified for training to follow the week after fire and police. From a point of view of our local private providers, we're working with some of our larger high-risk settings, so some of our food manufacturing organisations and also our logistics and distribution centres, because they do tend to have large numbers of people and quite challenging layouts from a point of view of infectivity. And we're hoping to go live with testing from next week, so the 11th of January, with some of those. The wider community and general public asymptomatic testing is more of a challenge, as I'm sure you can appreciate, similar logistically to the rollout of vaccination centres as well. So we're looking to identify sites. We're hoping to work with the university who've been doing testing with their students to learn from them and potentially utilise their site. A lot of ongoing discussions, but I'll be able to give you an update in the next couple of weeks as to where those likely sites are. But again, that will be another tool in our toolbox in the fight against COVID. So good news, and again, good progress over Christmas. But again, people must stay vigilant. Even if they have testing that says they're negative, they still could contract it later that same day. So you've got to stick to the hands, face, space rules.
Thank you very much, Lucy. Good news on the testing, as always. I think we've maintained a very high level of testing in the county, and we can be immensely proud of that because it has been extremely helpful in our battle against COVID. So I'll come straight on to you again, Lucy, for contact tracing update. Sorry, couldn't say that. I could put my teeth back in. Contact tracing update. Again, very valuable tool, particularly with the high levels of infection that we're seeing at the moment, to be able to trace people. So over to you, Lucy.
Yeah, absolutely, Councillor Morris. As you say, this again is one of the key things that enabled us previously to get back on top of our rates, is identifying those people that cases may have been in contact with, getting them to isolate to break that spread of onward infection. So there was a slight dip in performance over Christmas, as I'm sure people will have anticipated. The national team took over. We did no local contact tracing, and therefore our contact follow-up did dip back down to the sort of national levels. This was also compromised slightly by people's reluctance to admit who they'd been in contact with over Christmas. We do think there was still some people bending those national rules, and therefore we've also seen an increase in the people who weren't willing to engage in that process. So please, we're not here to make judgments. We are here just simply to protect the people who clearly you care about because you mixed with over that Christmas period. So if anybody does get in contact with you over the fact that you may have been exposed or you're a case, please do comply, engage with us, and all we're interested in is your welfare. So to give you the right advice to make sure that you don't either contract it yourself or pose a risk to other people. But we are obviously looking to get back our key rates back up to 87% uptake and follow-up, which is what we were achieving before Christmas. And we've now also developed self-isolation support packs. So those are being posted out to people who can't access a digital version. That gives you lots of information and advice about keeping yourself healthy while you're having to isolate, obviously looking after your mental well-being. We recognise that self-isolation is no fun for anybody. So just giving you tips about how to keep yourself buoyant, and also obviously just how to reduce the risk to anybody else that you may be sharing a house with. Quite often we're still seeing onward transmission within households. So again, just reinforcing those top tips about how to reduce risk to yourself and those that you care about locally.
Thank you, Lucy. As always, worth reiterating, this isn't a big brother thing, the contact tracing. It literally is for safety and to try and get on top of these numbers. So thank you for that. And thank you to the teams that are doing the contact tracing for us as well. I mean, must be becoming an increasingly harder job with the numbers increasing. So give them all the praise that they require for the hard work that they've been doing. I'm going to come on now to a comms update from Claire Hughes. Claire, are you there? Hi,
Yes.
Claire.
Hi everybody. Yes, just a very quick update from me. Obviously, since the introduction of the lockdown, we've prioritised updating all of our communications messages through all of our channels to ensure that everybody is clear on what people can and cannot do under the new lockdown. And to also reinforce why it's important to do everything that we can to reduce the transmission of this virus by staying at home and following the guidance on personal behaviours and actions. We're also creating materials as things develop. We're creating materials to help specific groups. So, for example, with carers, we're aiming to get a how-to guide and a video on how to don and doff PPE, and that's all about, we know that this virus is more virulent, so just being extra cautious to make sure that we're preventing infection and controlling that transmission as best we can. Also, just a reminder to people who were shielding in the first lockdown, they should be shielding again. And we've got advice on our website signposting if people require help for that. Given the critical situation that we're in at the moment, obviously we've heard from colleagues, the numbers are increasing, we've got pressure on our hospitals. We are going to be stepping up our harder messaging. I think it's that there's obviously clarity out there that there's some people aren't seeing how important and how dangerous this virus is to some people. It is causing deaths, it's causing serious impact on families and friends for people. So we are going to be putting some harder messages. That might not land very well with some people, but I think it's a necessity. So do follow us on our social media feeds. We're always providing updates, top tips, and we're always looking for other people's ideas about how we can get people to follow the guidance. We've also got some GOMO vans and iWalkers. You may, if you're out and about doing your daily exercise that you're taking within the restrictions, we are going to be placing those in key areas. Again, just to remind people, because we have had incidences in parks and green spaces where people seem to get outdoors and forget some of this behaviour of hands, face and space that they need to adhere to. So those GOMO vans and the iWalkers are being distributed in those locations where we know there's sort of non-compliance and people are forgetting to do the right thing, and that's there to remind them to do the right thing. I think that's probably about all. Now we'll continue obviously in all our other updates, reminding people about testing and where to get testing, and why you should get tested, what you need to do if you need to self-isolate, etc., etc. But all of our information is readily available via our social media feeds. As I say, we're out and about on our mobile assets, and we have our website where we're always updating FAQs and linking into the government advice. Thank you.
Thank you very much, Claire. And again, thanks to the comms team who have had to be nimble of foot, I think is fair to say, with all the changes that have been going on nationally and locally. And I think you've done an amazing job of getting the message out there, but we need to just reach those hard to reach people that aren't necessarily following the guidance, which is a shame, but we will get there. I'm absolutely sure of that. So thank you everyone for coming today. We've got our next meeting is on the 21st of January at, I believe, the same time, so it'll be at 8:30. Next week we have the all-member briefing at the same time at 8:30, so I would encourage as many councillors as possible to come along to that next week. And then tomorrow we also have the press conference, I believe, Claire, at 3 o'clock again, coming back into the regular cycle, at which I think some of that hard messaging will start to filter out to everyone. Claire, did you want to comment on that?
Yeah, no, I think that's, if you want to find out the latest situation, I think the press conference is an absolute imperative for you. It will give you the latest situation on facts and figures, what's happening and what all our partners are doing to help with the cause of trying to reduce this horrible virus and keep everybody safe.
And we will send a link round. We'll send a link round to everyone that wishes to watch that, so that they can watch that. They are all archived anyway. If anyone is interested in a back catalogue of our press conferences, they're all available. But we'll send out definitely a link to where people can find that either live or afterwards. Sometimes we don't go out live. Sometimes we record it, but it's always available very quickly. So on that note, I will close the meeting. Thank you very much for everyone attending today, and see you on the 21st of January, if not before. Stay safe.